Thank you, Eddie, for the presentation. Last but not least, our next speaker is Raine Cortes. She is from the AsiaPacific Transgender Network based in Thailand. Raine is a trans woman advocate from the Philippines and has a master's degree in health social science. She has more than 10 years of professional experience in mentoring and evaluation, program, financial, and grant management of HIV and AIDS prevention and control, community system strengthening, and trans-Pacific health and rights-focused interventions and research. Raine's presentation is called U equals U and Stigma in Transgender Community.
Hello, everyone, and welcome to this session. For this specific session, I'll be talking about U equals U and the stigma in the transgender community in Asia and the Pacific region. The Asia-Pacific Transgender Network, the organization I'm working with, is a trans-led organization and a regional network that engages with different partners across Asia and the Pacific region, and we advocate for fundamental human rights, including gender identity, as well as access to justice and legal protections, and of course, comprehensive gender-affirming healthcare and policies for trans and gender-diverse people in this region. And we generally work with country trans-led and trans-inclusive community-based organizations in 4 sub-regions, including Southeast Asia, South Asia, the Pacific, and East Asia. And since our network revolves around consultative processes and ensuring that voices of the communities on the ground are heard, we consulted and gathered inputs on this U equals U session and the corresponding stigma among trans community with around 17 country partners in Thailand, Philippines, Indonesia, Vietnam, Timor-Leste, Myanmar, Laos, PDR, India, Nepal, Pakistan, Bangladesh, Mongolia, Papua New Guinea, Samoa, and Tonga. So a lot of the things that you will be hearing for this session are coming from the perspectives of our communities on the ground. The work that the Asia-Pacific Transgender Network revolves around ensuring that we provide guidance and reference materials for rights-based comprehensive healthcare for trans people in the different parts of the region that we are working with. And as a context builder to this session, currently the estimated population of trans people in Asia and the Pacific is 9 to 9.5 million, which remains to be a very low estimate. And based on HIV vulnerability of trans people, they are 12 times fold higher risk than general population. And given this HIV vulnerability, specifically about transgender women, that there is related HIV stigma and transphobia that creates the barriers to accessing of HIV testing, even prevention interventions and treatment services by transgender people. And again, this is only mostly focusing on transgender women, which is seen to be a key vulnerable population and not including transgender men or transmasculine population. One of the things that we consulted with our partners in this consultation and presentation is what is their current understanding and awareness of U equals U. And surprisingly, that most trans people actually have very limited or low awareness and knowledge on U equals U. And this remains to be somehow a very new concept to them, even though it has been years that U equals U has been proven by science to be very effective. And for those that are aware of U equals U, these are mostly pertaining to transgender women, which are considered to be a key population for HIV programs, and that U equals U is not discussed and focused on among transgender men and transmasculine people, where there is very limited data in terms of her vulnerability as well. Those that are most aware as well are trans people who are working in HIV-related programs and services coming from community organizations, and those trans clients that are actually accessing HIV services. For those that who are aware of U equals U, they actually see and understand that U equals U is a goal to attain and maintain. And actually in some countries, U equals U is not fully expounded and only explained in the limitations of the context of viral load and why it needs to be maintained and controlled to be low. In terms of existing campaigns in countries, that are targeting trans people or transgender people living with HIV, many of the communities on the ground are not aware of any campaigns on U equals U, or there is actually no existing campaigns on U equals U currently in those countries. And for campaigns that are existing, these are done using social media, and they are designed generally for people living with HIV, and mostly are done by specific organizations rather than a national level intervention for U equals U. And of course, there is no trans-specific campaign that is ongoing on U equals U in any of the countries that we work with. U equals U in those countries becomes part of their prevention awareness campaigns, and in some countries, they're also supporting trans-led community organizations to actually have and develop their own trans-specific campaigns on U equals U. And these were just actually some of the U equals U campaigns that are happening in Vietnam, Indonesia, and in the Philippines. It revolves around information and awareness and messaging through social media, Facebook, website, infographics. They do online interactive shows, as well as messaging and using, for example, hot doctors or nurses, as you can see on the right side. But as you can see, all of this messaging are catering to general people living with HIV, and none are specific to trans people, which is still remains to be a lacking component. In terms of the context coming from the healthcare providers and knowledge of trans people, if this U equals U messaging and principle is being used, most healthcare providers and community-based organizations that are peer providers are including U equals U in their prevention messaging and even on their one-on-one counseling and IEC materials. But this is not very consistent. Not all healthcare providers include U equals U messaging in their counseling, and there are varying practices in the public and private settings of healthcare professionals. There are also some openly PLHIV advocates that are openly talking about U equals U, which is a good intervention, but none of these ambassadors or advocates are actually transgender people in the region. So is there really a stigma in terms of U equals U within the transgender community? Due to the lack of awareness and knowledge on U equals U itself, stigma in U equals U is not very clear among transgender people. However, what we need to look at is the other intersectional persisting stigma that affects transgender people in terms of accessing healthcare services, including HIV services, regardless if there are vulnerable populations or people living with HIV. For example, the persisting stigma among trans people in accessing healthcare and HIV services for the fear of being discriminated due to their SOGI status or sexual orientation, gender identity, and expression, or even because of their occupation, maybe as a sex worker, and even their different sexual practices. There remains to be a lack of sensitivity among healthcare providers and health facilities, not recognizing their gender identity, especially for countries that don't have policies for legal gender recognition or change of gender markers, for some experiences of misgendering, and of course, the typical stereotyping of LGBT community, especially trans people, as carriers of HIV. There is also stigma of knowing one's status among trans community because it could lead them to losing their jobs or even not being accepted by their family, especially in jobs, for example, in bars that may require them to actually do blood tests. An important stigma that needs to be addressed in relation to this is the fact that in healthcare settings and in some countries, they remain to be pathologized, being diagnosed with gender identity disorder or gender dysphoria for them to be able to access free healthcare services and be seen as having a mental illness that needs to be treated. There's also an interesting stigma that needs to be looked at in the context of contraindication of antiretroviral therapy and hormone replacement therapy or gender-affirming hormone therapy, wherein in cases that a person or a trans person is given a choice whether to either take ART or HRT, because there were some cases and stories or accounts that doctors are letting them choose and prefers them to take ART and stop their HRT. And it's a matter of a choice for the trans person to actually take into account which is prioritized or equally important for them. And for trans people, there remains to be a stigma of being economically vulnerable. And as we know that viral load testing is not usually free in most countries, and the ability to consistently pay and to monitor for viral load testing will remain to become an issue, because trans people who are economically vulnerable need to prioritize which costs they need to focus on and earn for, and to be able to maintain their constant living. This, of course, leads to low testing uptake, treatment initiation, and treatment adherence as well. In terms of key messaging and key recommendations coming from the trans community, especially in the context that U equals U is fairly a new concept for most trans people, and greater awareness and knowledge needs to be embedded within the trans community. So these are just some recommendations coming from the community to have a trans-led and trans-specific U equals U campaign and messaging, especially through social media, which is very useful, and having a trans PLHIV support group that understands the issues of transgender people in general, as well as having trans people living with HIV as ambassadors in promoting U equals U among the trans community. The other statements in here are specific recommendations or key messages that the communities are sharing. And let me just read to you a few of them. For example, awareness of U equals U principle is also U equals U offering freedom and hope, and be aware of U equals U and stop stigma and discrimination among trans PLHIV. No stigma equals no new HIV infection. Adherence, positive living, and well-being. Keep testing, keep informed, keep smiling. And as part of taking care of oneself in relation to one's self-worth, it is imperative to focus on adherence to treatment for HIV, like our adherence with hormone therapy. So if you would like to learn more about the work of APTN, especially our country partners, our trans-led organizations, and trans-inclusive partners on the ground, please do send an email to me, or you can also visit our website, our Facebook, and our Instagram account. Once again, thank you for listening and have a good day.